This is the Bartholomew Town Podcast.
Hey everybody, welcome into another edition of the Bartholomew Town Podcast. Bill Bartholomew here with you, as today we have a really relevant issue that is a component of something that's obviously dominated the news cycle over the past several days. We taped this episode last Friday, which is the day after Attorney General Noia, as well as the FTC, announced their decision to not approve the proposed merger between Lifespan and Care New England, with Brown University playing a significant role in what they described as an integrated academic healthcare system. So this proposed merger not approved on antitrust grounds, and frankly, as Attorney General put it, a lack of detail orientation in the financials of the plan. And the merger would have created, what would have been ostensibly a monopoly on healthcare in the state. The general posited that it would have been about 80% of healthcare would have been controlled by this one entity. So a lot of factors went into that. We've had a lot of coverage of that on different platforms, on the radio and certainly on digital and even on TV. I was on the Lively Experiment last Friday to discuss this. But, underlying all of this entire conversation is a very practical issue, which has come up throughout the course of the pandemic and certainly in the aftershocks of the pandemic. And that is, quite frankly, the workforce inside hospitals and the recruitment, the retention of workers, the lifestyle, work-life balance. There's so many factors that go into this. And certainly compensation has been one thing that has been an issue. Burnout has been another issue. We hear so much about a lot of the negatives and, frankly, the numbers when it comes to healthcare, right? Numbers of how many workers didn't get the vaccine and what's that going to do? How much money does this particular entity have on hand in terms of capital so that they can make particular investments? What's the salary of X administrator? But what about the human beings? What about that reality? And today we welcome on Alexis Devine as well as Jazmynn Noia, who exemplify a really cool program that Lifespan has developed that not only engages and trains would-be healthcare workers, but also does so in a way that it creates a pipeline from those who are somewhat left out of the conversation when it comes to workforce development. Essentially provides a pathway to a fulfilling opportunity. So kind of filling two voids at once, right? We talk about disadvantaged people in terms of the urban core and beyond, who that pathway to success is often inhibited or sometimes inhibited. So it's nice to have just a change of tempo or a change of vibe in both of these areas, right? Addressing gaps in opportunity in our community and addressing a healthcare worker situation, for lack of a better term. So great stuff today. Hopefully you enjoy this, and perhaps you or someone you know will be inspired by it to engage with the program and get involved in this world, this thankless world of healthcare professionals. You know what I mean? You say what you will about any of the organizational or, the nature of the healthcare industry in our country. We can go on tangents for, we could probably do 2 years straight, just hit record and just start ranting about insurance and gaps in opportunity and access to care and everything we've learned from the pandemic that we probably already should have known. That's all there. But the human beings on the ground, that's who makes things work. The workers make things work or not work. So in all of the discussions we have, I'm personally starting to look back on 18th century, 19th century worker conversations, particularly in our area here in the Northeast, Rhode Island, Massachusetts, and particularly around the time of the Industrial Revolution. And obviously, there are major problems with working conditions in that period. No one's suggesting it was like, back in the good old days. But there are things that are positive we can learn. And as I continue to explore that more in depth, it's certainly not the first time I've paid attention to that area, but looking at the role of the press, the role of workers' rights, what the goals were, and what was generally accepted as best practices. in terms of goals, in terms of worker control of the means of production. Those are things that I want to be more informed on so we can have broader conversations on this broad issue. But for today, a look at a very successful and intriguing program that Lifespan provides, and again, hopefully you enjoy it. If you'd like to support the independent journalism, opinion, analysis, and entertainment that the Bartholomew Town podcast provides, simply follow, rate, and review wherever you're listening right now. And if you want to go a step further, you can become a B-Town Insider for as little as $3 per month. Head to patreon.com/BartholomewTown, and you will receive exclusive monthly content, all kinds of little interviews, opinion things, who knows what else I'll put up there. That's for the B-Town Insiders, and you B-Town Insiders out there, you have helped to sustain this program in ways you can't even imagine. There are a lot of costs associated with an operation like this. Just the fundamentals, bedrock programs, bedrock things that need to happen on an IT side and on a practical side. So you've been very supportive of that, and we appreciate it. And as always, thank you all for listening. Now my conversation on a workforce development program put forth by Lifespan that's making some significant changes in our community. Okay, so today we have a very timely conversation that is, major news in healthcare. We're taping this on Friday. This is going to air on a Tuesday, but look, with the integrated academic healthcare system, aka the hospital merger, basically being shot down by Attorney General Noia as well as the FTC, there's a lot of talk about different things surrounding sort of the orbit of healthcare in general. And one thing that is without question a major factor, we saw it play out and we continue to see it play out with the pandemic, is workforce. And there's so many contributing factors to that. And today we're going to kind of take a look at an interesting approach or angle to this. So I will ask you, lovely ladies, to please introduce yourselves and kind of set the table for us what exactly we're talking about today.
Good morning, Bill. Thanks so much for having us. I'm Alexis Devine. I'm the program manager of Lifespan Workforce Development. I've been in this role been with Lifespan close to 20 years now. So clearly I'm quite committed to it and appreciate all the opportunities it's afforded me and others. In this role, we designed a workforce development summer youth employment program. So it's this Lifespan Summer Youth Employment Program. And I can give you a little bit of background about that, but the model of it was we used it as a model to then create an additional program called Workforce STAT, that's Solutions Training and Teamwork. The model is to provide opportunities to go to school, to then do an internship in areas in healthcare focus where we have a shortage, and then to ultimately prepare people with the skills to be eligible, highly well-trained, rooted in our care values at Lifespan, so they'd be eligible for the high vacancies that we have in healthcare. And we've had some great successes, but it did start with the youth employment program, and that's how I met Jazmynn. And specifically, that program hired young people from underserved communities and placed them in actual employment, not internships, not volunteers. They were employees like I am, to work 8 weeks in the summer. But then what makes us particularly unique is that we offer workplace readiness training, 21st century skills, used to be called soft skills, life skills, but they're really the hard skills we need to make someone employable, social emotional learning, as well as that core, employability skills, punctuality, communication, and more, to make them prepared for the workplace. So then we look at training for skill, but hiring for attitude, with the skills that are really necessary to grow. And that's how I met Jazmynn when she was a teenager and very young in that program. And then she's grown and certainly been a model and, in this field. And I look at her now and I said, oh my goodness, she's a grown woman, and she's really reflects all of this work well and shows how much can be done with it and how much it supports the healthcare system overall.
Yeah, Jazmynn, if you could kind of talk about that and sort of your pathway into this workforce. I think it's so relevant right now. I mean, it always has been, but when we talk about healthcare in the state, the workforce is obviously the bedrock of that conversation. So how did you get into this stuff, and where do you find yourself now in this particularly challenging moment?
Yeah, so I'm Jazmynn. I'm a hematology nurse practitioner now working at Emory University Hospital in Atlanta, Georgia. It's crazy that it's already 2022, and to say that I started in the Summer Youth Employment Program in 2010 at 17 years old, and it was my very first job in general. I say, like, think of any fast food chain, and I applied to it, but could not get a job throughout high school. But then between the graduating high school and starting college is when I'd applied for the Summer Youth Employment Program, really not thinking that I had a chance to get in, but trying very hard because this was a paid opportunity. It was in healthcare, which I always say my mom was a big advocate as an immigrant. I'm a first-generation American and first-generation college graduate. My mom was always like, you have to go to college. It's really not a question or a thought. You have to go to college. You should get it. You should be a nurse. It was always, you should be a nurse. And so this was planted early on, but without any context for me. So I started volunteering at Rhode Island Hospital my senior year of high school, applied to the Summer Youth Employment Program and started there the summer of 2010. Not knowing this was then going to be my summer job all throughout the summers in between college, and really shaped the direction that my career has headed in. So 2010 to 2013, each of those summers, I worked at Rhode Island Hospital. The first summer, it's pretty standard that we work as transporters, which I still say to this day has been my favorite job that I've ever had. If I could do that now and get the same amount, excellent job. And then after that, I was a unit assistant and a nurse's assistant for the subsequent summers. And the experience that I gained was incredible. It's the networking that you learn as well, the value of $1 and how to start saving. And if you're looking for a career in healthcare as well, it's your foot in the door. It's figuring out your patient population of choice. I still say that first summer you do an informational interview of one of the employees at the hospital. Ideally, it's someone that you're interested in their job and you want to learn more about it. And I interviewed a hematology nurse practitioner in 2010. Fast forward to 2020, and I was applying and interviewing for my very first job as a hematology nurse practitioner. So it really was very full circle. I feel so lucky, and I love that now, 10 years later, 12 years later, I guess, I can speak to how much I gained from that and how that really set me on the right path. So I'm happy to be one of the many faces of the program because it's benefited me very much.
Yeah, and I know this is an audio program for the most part, so I'll have to play a little theater of the mind right now, but you have a great energy. You seem like really relaxed and glowing with passion about this. And a lot of times when we talk about the labor force within hospital settings or within healthcare, broadly speaking, I mean, look, there's wonderful people with wonderful energy every single day. But a lot of times it comes across as what we're hearing lately is, look, there's major shortages, there's compensation issues, X, Y, and Z. And you forget about the people who love this work and want to be here. Or at least it's not the first thing that we're met with when that workforce conversation becomes part of the general public realm, if that makes any sense. What are some of the barriers to careers in healthcare right now, and how are you in the organizational context of Lifespan broadly, but then within your program, how are you trying to overcome those barriers? Because look, let's be honest. I mean, the nursing shortage right now, the shortage of CNAs, it's a major, I know I've said this like 50 times, but it's a major deal. A lot of people are very on top of this. What are those barriers?
It's been very difficult in the job right now. You mentioned the CNAs, the nurses, it's at every level. So we do feel that at work. I think it's difficult, but we're trying to keep people connected. It's referencing friends that to get other people interested in the job, get the hospital on board too, because one of the big things is recruitment is really hard, especially now. But in general, I think it's hard to get a hospital job if you don't have connections. So it really is connecting people. And I still, to this day, pass forward when the applications come out for the Summer Youth Employment Program and Workforce Development, I'm passing that along to the youth in Providence that I am still linked up with. And it's really connecting people to make this sustainable, because it's hard in general and it's hard now. Like I've been working since 2010 in healthcare, and you can feel the change over time and the change in energy too. So I'm glad you mentioned that. I try to stay very optimistic about it, because I am working with people who are at a really difficult time in their life, period. I might be having a hard day, but I think their hard day wins if they're a hospitalized patient or family member. And so you have to keep that perspective. Otherwise, it's not sustainable. So,
Alexis, right now here in Rhode Island, and I think it's even rippling across the nation, is the merger conversation, and that draws people into the healthcare industry in terms of financials, and does this company or this corporation or this not-for-profit have involvement in a particular facility, so on and so forth. Can you humanize the issue of the healthcare workforce right now in terms of a developmental and retention perspective and a recruitment perspective? And again, going back to the bedrock of care is obviously the science behind it, but then the people who are providing that care. Can you kind of humanize that, put a human face on what is right now, at least the dominant conversation, really a numbers talk?
Yeah, it is. I live the humanized role in this, and that's why I love what I do. Like Jazmynn, I often say, this isn't what I do, this is who I am. And that's the component where in this area that I'm able to be effective. I'm seeing people bring in, they're coming into, I've been saying lately, they're going into a fire while everybody's running from it. And it's hard to attract people to do that. So those that we're attracting are really pausing to say, I want to have a role in this. I want to be able to impact the things that are happening around me that are contributing to falling apart, if you will. I mean, people who are coming into healthcare, I've asked some of our trainings, I say, why are you interested in this? It's how we start off. I run all of our workshops in that work readiness area. And often the response is because I've seen what's happening to, I've seen firsthand how this pandemic is affecting people, whether it's in my community, my own home, and more. The majority of people, or all of the people who come through our programs, are from underserved communities. So our target population is unemployed and underemployed. So they are living in areas that are, experiencing the disparity in how this pandemic does not choose. This pandemic does not discriminate, but there are areas where there are greater cases. And so they're coming from those areas with a sense of, I want to be part of this change. And the recruitment is really, really hard. Recruitment is very hard from any community, any demographic level of education. It's very hard to ask somebody to come be part of this. And we prepare them for what they're going to see. We prepare them and say, your coworkers, your managers, they're your patients too. And to Jazmynn's point, we say, if you're not in that bed, you're okay. And when we go into that workspace, we have to bring our best selves with with the patient first perspective, and they do just that. So we're drawing and attracting those who are following a calling, and then we are supporting them in pulling that out and identifying that as really part of who they are. In our workshops, we do a lot of support through compassion fatigue training. We do training around things that people aren't talking about so that they can go into a space and feel like it's inclusive. Our trainings include LGBTQ affirmation in the workplace, implicit bias, accountability, because it's hard to go into this space. You go in wanting to make a change, and then you say, oh my goodness, they're burning out. They are burning out, but they're staying with it because they see the goal as the priority. So in terms of the human side of it, I feel like everybody in the organization is so grateful for people to come in, from our recruiters to our leadership to on those floors. And they're busy. Those who are coming in are busy. It's hard to do the training, but there's a gratitude there because you're here to help us. As I said, recruitment is a great challenge. And so one thing I think that organizations, as much as we talked about the merger, and I kind of stay removed from that, and that's what's exciting, I think, about my role, is I can really focus on the how are we having an impact, period, as Jazmynn said, how are we having an impact? And so that's where organizations, and I will say Lifespan, they change their benefits. They recognize what people need to come in and be an engaged, retainable workforce. And they said, we appreciate you. And that's something that we always knew was there, but that's something that's just that is the message within the system. And so we can focus on the direct contact and trust that, administratively, there's choices being made with our best interests in mind. But it's hard to see. It's hard to see from an outside perspective because that is what gets attention, is those numbers and again, the intent. When we see it on the ground like Jazmynn does, there's magic that takes place because I can't speak for her, but she is seeing people's lives end, and she is part of that and making that transition. Being part of that transition, that is a great challenge, and knows that that's her calling. As she mentioned, she discovered 10 years ago, 2,000 people have come through that program, and I've seen many like her have discovered in the very beginning, wow, what is this all about, and have stuck with it.
Yeah, and all of that has nothing to do with the outcome of a merger. I mean, I guess you could argue that the numbers of employees could shift or something like that, but at the end of the day, that is all much higher up in terms of the mental space that it takes up on the ground. You know what I mean? It's like, okay, whatever, you guys figure that out. We've got patients to care for on the ground. That's priority number one. For daily coverage of all things Rhode Island politics, news, innovation, healthcare, music and arts, and beyond, follow me on social media, Twitter, Instagram, TikTok, Facebook, LinkedIn. It's all there for you. Just search for me, Bill Bartholomew. There's one thing that we all learned during the pandemic, and that is the value of communication. Well, I don't know if we all learned that, but some of us knew it, some of us maybe didn't. But one thing we should have taken away is the value of powerful communication. And B-Town Media can help you communicate your idea through podcasting. Now, there's a lot of ways you can do this. You can just take a Zoom call and, post it somewhere and hope that people care about it. But what about the audio quality, the video quality? How about original theme music? How about making this into something that's infotainment? Well, I'd be happy to help you do that, and you'd be surprised at how cost-effective this can be. Simply email me, bill@ripodcast.com, and let's get started on your project. Let's communicate your ideas in a meaningful way to an unlimited audience. Podcasting has grown enormously over the last several years, and guess what? You can be a part of that. There are no barriers to entry besides just saying, I want to do this. So let me help you. bill@ripodcast.com. Let's see what B-Town Media can do for you. Now back to B-Town. I guess, right now we're in this moment, if I'm on TikTok, believe it or not, and I'm scrolling through, there's a lot of talk right now about the Great Resignation. And I think some of that's true. We saw it with the pandemic, people realizing, hey, my job in perhaps a restaurant setting or in any other sort of frontline setting that isn't very well compensated and isn't very fulfilling is actually putting me at risk of physical harm potentially, or at least it's mentally taxing. And, people discovering various roles that they can do from home. I mean, we're seeing side hustles. How long is that going to last? People who are, buying things at Marshall's for $19 and then selling it on Amazon for $29. I mean, how sustainable is that? So in the context of the Great Resignation, I'm curious, Jazmynn, what was the moment that you realized, I want to care for people in a healthcare setting? And what's your message to people that are just straight up done with whatever career they are currently in, that want to make that transition or are unemployed, just totally unsure what to do? What's your pitch to them to say, we need you inside our facilities and you can have an impact on people's lives that is in such a unique and meaningful way?
That's a big question, but it's so important right now. It's how do we bring people in? For me, it's finding the people who love others, care for others. Like, you need to come in and you need to, again, you're having a hard day. You just need to remember that somebody else is too. And especially in healthcare, like, this is so relevant. You can compare, and this is something that happens frequently. You compare patients and you say, this patient, they're complaining a lot, or they're asking for all these things, but next door, this person is dying, or this, like, you start to put that perspective on it, or compare in a way that isn't fair to the patients. And you need to keep that in mind. And I think I'll speak to the program again. That's another huge thing that we learned is perspective. And you don't know the person's story sitting right next to you unless you ask, unless you find out, you dig a little bit deeper. So I think we need people in healthcare. We need people who are very caring to come into healthcare. And I think that's a huge thing right now. It's hard to get people to stay at one facility when travel nursing is such a big pull at this point as well. I have so many friends going to that. I'm like, wait, let's stay put and, like, fix our communities right here. Like, stay and work on that with us. But it's, I guess, the way to recruit everybody. What's my take home message?
Your elevator pitch here.
My elevator pitch. I didn't know I was getting an elevator pitch. I think we need to support each other in and outside of the hospital. We need to support each other, but our hospitals are hurting right now, and we still have so many good people that we need to support. And if we can get one more person in there, it makes a huge difference. We can work on retention. That's a huge thing that has been an issue. So it's supporting ourselves, supporting our team, and supporting all of the incoming members into healthcare. That's the biggest.
Yeah. And so, Alexis, I'll ask you that. And I'll also ask you if you could just sort of lay out for the listeners, if they're interested in getting involved in this program or want to refer somebody, how to get in touch with you and how to make that happen.
Yeah, it is. And Jazmynn is absolutely right. It's being part of, a community of healing, and in a time where we all really need healing. I will often say to people that are coming in the program, what they bring from their own trauma and their own experiences and their own stories sometimes makes them even a better fit for this role, because they've figured out how to care for themselves and care for those around them. Prior to additional training. So, for instance, we have a CNA program, a pharm tech, behavioral health specialists, and we have a medical assistant program. And all people who come into those programs bring something that's special, that that connects to something they've gone through. One of the other things that we offer in our programs is to address barriers to employment, as you mentioned. So, psychological barriers, financial barriers, we provide wraparound services. So as you come in through this program, it being very unique is really seeing that. What do you need to be successful in this space of healing? And it's pretty powerful to be a healer, I think. And so, while it's an industry where there is recognition of the need to, in some of the career paths that I just mentioned, to increase wages, but it's really powerful to not just do this for wage, but to do this for a purpose. And as I mentioned before, calling. We have so far in our work have had since I've been here, 2,000 people come through it. We've seen it contribute to increasing recruitment and retention, people going right into jobs. And you are able to get involved is lifespancareers.org. There is, that's how individuals can apply for positions at Lifespan and for our programs, Lifespan Workforce Development. And even if you Google Lifespan Summer Youth Employment or Lifespan Workforce Stat, that's STAT, that will bring you to the links that will show the opportunities that we have available. And we really do. We need people who want to be here. And it gives also more information about what does that mean? What does it mean to be a behavioral health specialist? That sounds, as soon as you hear specialist, it's like, well, I must need something. And what it means to be a behavioral health specialist or any of those other things is to be a caring person. And so a pharmacy tech is obviously in the area of pharmaceuticals. It's a pharmacy technician level 2, medical assistant, nursing assistants, so certified nursing assistants. But I mentioned the behavioral health specialist because that's an area that's unique where we have a shortage like the others. But that focuses on mental health. And that's something where we're seeing, the need, obviously, but it's getting a lot more attention now. And it's not one of those really obvious things that feels like it can be trainable, but it is. Yeah, it's a position that all of them we give advanced training. It's all free. All of it is free. All of the classes, all of the training is free. And then that's the Workforce Solutions Training and Teamwork Program. It's all free. Free support for barriers to employment, childcare, things that we're talking about. How do you go into this workforce? There are jobs available, but how do you go into this workforce when your whole life has changed and resources you once had are not there anymore? And so we support with resources. We have case managers who help navigate systems that do offer support for those barriers. And then we provide the experiential learning part with the internships. And then the goal is we have a career transitions coordinator. The goal is to get someone employed. And I mean, that is what we're doing. And the end goal, if you will, is for our patients to have really qualified individuals who want to be there. And I should mention our partners in it, the educational partners are CRI and Rhode Island College. So it's a true partnership that's coming together to advance this field.
Sounds to me like an integrated academic healthcare system that's already happening here in the state. So on that note, Alexis, Jazmynn, thank you so much for your work. We really appreciate it. And let's keep in touch.
Rhode Island's podcast of record, B-Town.
At HealthSource RI for Employers, we provide access to health insurance to more than 1,100 local businesses and nonprofits, and 96% of them renew through us every year. Maybe it's our choice of 19 different health plans, our 10 years of customizing solutions, or our one local team of dedicated experts helping employers find quality health insurance. See how our numbers stack up for you. Learn more at healthsourceri.com/employers.